As we finish off this module, let's talk about avoiding yoga injuries. Okay? Prevention is the best medicine. We're going to look at common injuries that may result from practicing yoga. We're going to look at repetitive stress injuries, or RSI. Repetitive stress injuries are when an action done over and over again leads to an injury. We've looked at several RSI so far: carpal tunnel and tendonitis. There are many repetitive movements in yoga. In yoga, injury is often due to repetitive stress rather than something traumatic. A small amount of discomfort or malalignment over time leads to issues. We'll now look at 3 common RSIs in the yoga practice. Knowing about them will help you to protect your students so that they can practice for a long time. Yoga butt is the repetitive strain on the hamstring attachment at the ischial tuberosity. The tendon gets injured from overuse and overstretching. Pain may also develop at the bursa of this attachment. Repetitive forward folds can lead to this when practitioners stretch, not at the muscle belly. How do we prevent a yoga butt for our students? We want to encourage muscular engagement of the hamstrings when stretching. Educate the students that sensation should be through the muscle belly rather than at the attachment. Encourage students to work for the sensation rather than trying to look like the cover of a yoga journal. Locate the sensation of a stretch in the muscle belly rather than at the attachment. When we look at shoulder injury, we can see chaturangas can be hard on the shoulders. Frequent misaligned chaturanga may lead to repetitive stress injury through the front of the shoulders. Frequently, students will not keep their scapula retracted but hunch forward. Notice in this picture her shoulders are below her elbows. That may not be optimal for long-term shoulder safety. This hunched position is emphasized by daily life, and over time, the back muscles, the rhomboids and the lower traps that work to stabilize the shoulder girdle may become weak. The hunched position creates a shearing across the front of the joint and asks the bicep tendon and rotator cuff to work really hard to support the weight of the upper body. We'll look at the shoulder RSI. How can we encourage safe shoulders for our students? We want to encourage students to use correct alignment by keeping scapula well stabilized on the back. We want to teach any sun salutation slowly and cue alignment. We want to resist jumping back in sun salutation until students are really ready and can hold the chaturanga for 5 breaths. Encourage students to find the chaturanga modification that works for them. Keep knees down to reduce load on the shoulders and use modifications such as cat-cow and knees down instead. Educate your students on a good shoulder alignment and sacrifice some of the flow for safety. Yoga has a number of rather intense poses that open the hips. However, if practitioners lack hip mobility, they may twist the knee joint instead to get the pose. Moving the knee out of pure hinge joint alignment can damage the medial meniscus of the knee. This occurs in positions where the knee is flexed, then asked to rotate, for instance, pigeon pose, lotus pose, or half lotus pose. How can we encourage safe knees when we are teaching? We want to listen to the whispers of the knee complaining so you don't have to hear the scream. Advise your students that there should never be any sensation in the knee joint. Advise them that sensation in the knee joint is a precursor to pain. Offer modifications for all poses that encourage extreme flexion. Educate students on good knee alignment and understand that just because it's easy for you does not mean it's easy for them. Avoid teaching high-risk poses in all levels classes and save them for workshops and advanced classes. Remember, human variation, the ability to do these poses depends on the range of motion of your hips, which is determined first by your pelvis and skeleton. Honor human variation. Some people will not have the hip rotation or connective tissue flexibility to do these poses safely. We have come to the end of Intro to Injuries in the Google Classroom for the 200-hour yoga teacher training certification students. You will find the student review, the assignments, and all of the things you need to do to upload and complete your module. I look forward to seeing the evidence of what you have learned, and I appreciate each and every one of you greatly.